Welcome to today's session. In today's session, we are looking at the preoperative care, and we'll start by looking at elective pre-op. So in terms of elective pre-op, we'll go straight to look at the outline of elective pre-op. Of course, you need to talk about the aims. They are almost similar or same aims in elective pre-op. The next heading is patient admission stroke environment. From there, you talk about psychological care. And the next heading is preoperative teaching, consent form signing, observations, investigations, nutrition. Then from there, you move on to the physical preparations. And the physical preparations are done in the last 24 hours before the patient goes to theater. And you talk about gastric preparation, bowel preparation, bladder preparation, leukocyte or skin preparation, removal of jewelry or dentures, patient identification, pre-medication, gowning, transfer of the patient to theater, post-operative bed, and of course the last heading is communication to the family. So let's go straight and look at how you can fill up these details of these headings. And it is important for surgery, pre-operative outlines, elective, emergence, or post-operative. Let the management be the way the outline is without you skipping any headings or mixing the headings up. So in terms of the details, of course, in terms of aims, you can say to ensure that the patient is physically well to withstand the procedure. You can say to provide psychological care to the patient, to promote physiological well-being of the patient throughout hospitalization, and you can say to prevent surgical complications. From there, of course, you can talk about other headings such as patient admission. And on patient admission, you can say I'll admit the patient in a surgical ward for specialized treatment. I will admit the patient few days before the surgical procedure to relieve psychological tension and perform investigations. The other point, you can say I will ensure that the environment is free from infections by performing damp dusting. The other point, you can say I will ensure that the environment is well ventilated to promote air circulation. And you can also say I will ensure that there is good lighting for easy observation. So these are some of the points among others that you can put on patient admission stroke environment. The next heading is psychological care, and you can say I will explain the condition to the patient to promote knowledge. I will explain how the condition comes about to the patient to promote awareness of the condition. You can also say I will explain to the patient on the importance of surgical treatment to relieve anxiety. I will allow the patient to ask questions and answer them accordingly to reduce anxiety. I will involve the significant other in the care of the patient to promote a sense of belonging. You can also say I will explain procedures being done on the patient to promote cooperation. So that's on psychological care. And the next heading we said is pre-operative teaching. On pre-operative teaching, you can say I will teach the patient what is expected of her or him before, during, and after surgery, such as restriction in nutrition few hours before surgery to promote knowledge. I will teach the patient on the importance of breathing exercises before and after surgery to promote breathing after the surgical procedure. I'll teach the patient on post-operative expectations such as tubes to promote knowledge. So these are the points that you put on preoperative teaching. The next heading is consent form, and you can say I will provide a written consent form and ensure that the patient signs the form to legalize the surgical procedure. You can also say the consent form will indicate that the patient fully understands the surgical procedure and is willing to undergo the surgical operation. The next heading is investigations, and these are some of the general investigations. Of course, based on the condition you're dealing with, you can put in specific investigations based on that condition. And you can say, since the diagnosis is already made, investigations will be done cardinal for the surgical procedure. For example, full blood count to rule out anemia, blood grouping and cross-match to identify the blood type in case of blood transfusion, random blood sugar test to rule out diabetes, and of course also X-ray to rule out chest infections or confirm a specific condition. The next heading is nutrition, and you can say I will assess the nutritional status of the patient to detect any nutritional deficiency. I will ensure that the nutritional status is promoted before surgery to improve the surgical outcome. I will ensure that the patient is eating nutritious meals rich in proteins, vitamins, minerals, carbohydrates to build the immunity. I will encourage the patient to take a lot of fluids to prevent dehydration, and you can say I will give small frequent meals to promote appetite. These and many other points can still apply. The next heading, of course, now we will even move on to physical preparation. And physical preparation, the first heading is gastric preparation. On gastric preparation, you can say I'll put the patient on new oral 6 to 8 hours before the surgical procedure to prevent aspiration during the surgical procedure. I will explain to the patient the importance of being on new oral to promote cooperation. You can say I will commence intravenous fluids to prevent dehydration. You can also say I will insert a nasogastric tube for use during and after the surgical procedure for feeding, of course. Bowel preparation, you can say I will encourage the patient to open bowels before going for the surgical procedure to reduce surgical complications. I will administer ordered enema to cleanse the colon. You can also say I will ensure that the bowels are empty to prevent fecal incontinence. The next heading is bladder preparation, and here you can say I will encourage the patient to void to empty the bladder. I will catheterize the patient for continuous drainage of urine during and after the surgical procedure. I will ensure that the bladder is empty to prevent any surgical complications. And of course, the next heading is leukocyte or skin preparation, where you can say I will shave the surgical area to remove hair which harbors microorganisms. I will use antiseptic solutions to clean the surgical area to remove any microorganisms. You can also say, ensure that the patient is taking frequent baths to promote hygiene and prevent infections. The next heading is removal of jewelry and dentures, and you can say I will remove the following. For example, dentures to prevent choking, glasses or artificial lenses to prevent infections, jewelry to prevent electric shock, especially where a diathermy machine is being used, and of course nail polish because it masks cyanosis. The next heading is patient identification, and you can say I will place an identity band on the patient containing the patient's name, age, diagnosis, type of operation, type of anesthesia, and the site of operation. The next heading is pre-medication, and you can say I'll administer the following drugs: magnesium trisilicate 500 milligrams. This one is given to prevent gastric acid secretions so that we avoid diseases such as gastritis or peptic ulcers. Atropine 0.6 milligrams. It reduces production of body secretions like saliva so that there is no aspiration during the procedure. Promethazine 12.5 milligrams to control nausea and vomiting, which is induced by anesthesia. Diazepam 15 milligrams to control spasms of the body. The next heading is gowning, and you can say before the patient goes to theater, I will provide a clean gown, as this will reduce transfer of infection to theater and allow easy access to the operation site. Transfer of patient to theater, you can say I will perform my final observations, collect all patients' records, and perform a checklist to ensure that everything has been done. I will transfer the patient to theater and give a comprehensive. And the next heading, of course, is post-operative bed. And you can say upon returning from theater, I will make a post-operative bed and tray in readiness for the patient after surgery. I will assemble all the emergency equipments and drugs on the acute bay for use once the patient returns. Then, of course, communication with the family. You can say, I'll tell the family where to wait from and expect a time frame of surgery to reduce anxiety. And you can say, I'll continue updating the family during the procedure to reduce anxiety. So this is the outline of elective pre-op, and ensure that all these points and even others that you feel you can add on, and but they should be at that particular heading, you can still add. Till next time, goodbye.